Mr. President.
Senator from Arizona.
I want to thank Chairman Grassley for his tireless leadership on lowering the cost of prescription drugs for Americans. And I'm proud to join with him on the floor today and join with him in his legislation that we must pass to help Americans and to help Arizonans. Everywhere I go and when I'm hearing from Arizonans, I'm constantly hearing about the rising cost of prescription drugs. It's among one of their top and most pressing concerns. From seniors who can't afford their medications, to parents struggling to care for a child who suffers from chronic conditions, out-of-pocket drug costs are too high. Far too many seniors and hardworking individuals in our state either can't afford both their groceries and their medications, or they've been forced to ration their prescriptions because of skyrocketing drug costs. In 2017, AARP Arizona reported that a whopping 26% of our residents stopped taking their medications as prescribed due to cost. Last fall, I heard from a constituent in her mid-60s from Green Valley, Arizona, who was diagnosed with rheumatoid arthritis and taking several medications to treat her condition. When she transitioned to Medicare Part D from her employer's health plan, her out-of-pocket cost for one of the drugs she was taking, Enbrel, went from $10 per month to nearly $6,000 per month. This is a 600% increase in her monthly out-of-pocket cost just for this drug alone. I don't know anybody who can afford $6,000 a month for one drug as a senior, as anyone. This is insane. She had to switch to another medication twice, but because they were infusions, she now has to travel 84 miles round trip to get treated. The significant jump in drug costs have affected both her pocketbook and her quality of life. This is unacceptable. And I've worked with my Senate colleagues on both sides of the aisle with Chairman Grassley's leadership over the past year and a half since I've been in the Senate to bring down the cost of drugs and help Americans save more of their money. Senator Grassley's bill, which I'm proud to be an original co-sponsor of, does just that by holding big pharma companies accountable for exploiting loopholes and keeping prices high for seniors, families, and taxpayers. Our bill pulls back the curtain on drug pricing and negotiations. It ends the sticker shock at the pharmacy counter, and it caps out-of-pocket costs for seniors so that Arizonans can afford the medicines they need. According to the Congressional Budget Office, our Prescription Drug Pricing Reduction Act would save taxpayers close to $95 billion, reduce out-of-pocket spending by $72 billion, and reduce premiums by $1 billion. This bill is even more important now that we are navigating a global pandemic and its subsequent economic challenges that are squeezing family and fixed-income senior budgets even more than in normal times. With over 17 million Americans unemployed, including many Arizonans, along with the ever-looming threat of the coronavirus, affording prescription medicine should be the least of their concerns. Our bill would give Americans and Arizonans one less thing to worry about during these extraordinary, difficult, and unprecedented times. Unfortunately, despite this bill receiving strong bipartisan support up to just a few months ago, Democrats recently chose to walk away at the direction of their party's leadership, and they refused to join in on the reintroduction of this legislation that they co-authored. This only happens in D.C. Just to be clear, they were for it before they were against it. This is maddening. This is why people all over my state are so frustrated with the dysfunction in this place, where people are willing to put looking for power and electoral politics ahead of what people need right now. And right now they need relief, and they need relief to lower their out-of-pocket costs for all the issues that they're facing as seniors, as families, any of the diagnoses, any of the conditions, these life-saving and quality of life improving medicines. We've got to lower the cost, and now is the time to do it. Arizona patients and taxpayers and families and seniors, they need Washington to act now. I want to urge our Democrat colleagues, to put politics aside. I know it's hard to do in an election year, but put it aside. Service before self is one of the core values I learned in the Air Force. I bring it here with me today. Serving others first. That's why you're here. Put those politics aside. Let's act to lower the out-of-pocket costs of prescription drugs in our upcoming coronavirus relief bill. This is a pivotal moment for action. We have to come together as a Congress to ensure hardworking Americans, their families, and seniors can access the treatments that they need at an affordable cost. Let's pass this bill now. Thank you, Mr. President. I yield the floor.